Hello everyone, I am Basanagouda Patil, Agri student of University of Agriculture Sciences, Dharwad. So the course that is ASC 302 Livestock and Poultry Healthcare, and the course handled by the Dr. S.Y. Mukherjee, Associate Professor and Head, Department of Animal Science, AC Vijaypur. So today let us discuss about one of the important disease in the cattle, that is the traumatic reticuloperitonitis. So that is the one of the important and the dangerous disease in the cattle, that is the traumatic reticuloperitonitis, which is a hardware disease. So let us discuss in detail about this TRP, that is traumatic reticuloperitonitis. Okay, now before going to the actual topic, let us discuss about some facts which will be helpful in understanding the main topic clearly. So whatever the food eaten by the cattle from the esophagus will move into the stomach. Stomach contains four compartments called as the rumen, reticulum, omasum and the abomasum. The food which is entered the rumen will pass to the reticulum. From reticulum, it moves to the omasum through a vent or a hole called as the reticulo-omasal orifice, and finally from omasum to abomasum. So this hole or the vent, that is the reticulo-omasal orifice, which separates reticulum and the omasum. So this we have to keep in our mind. So this photograph says us, here we should note that reticulum and the heart are in clear vicinity. So this is a reticulum and this is a heart. So we can say they are in a close vicinity. So moving to the now let us get into the main topic, that is a traumatic reticuloperitonitis, which is a hardware disease. Commonly we call this a traumatic reticuloperitonitis as a TRP. So in future I will be using TRP to represent the traumatic reticuloperitonitis. So what is this traumatic reticuloperitonitis? It is nothing but the perforation or the holes of the reticulum. So when you consider this as a reticulum, the holes in the reticulum is the cause for this TRP, which is commonly and mostly seen in the mature dairy cattle and occasionally seen in the beef cattle and in other ruminants. So what is the etiology or the cause for this TRP? Cattle swallow the food whatever they get first, and then they regurgitate the food whatever they have eaten. ಅಂತಂದರೆ ಜಾನುವಾರುಗಳಲ್ಲಿ ಅದು ಹಸು ಆಗಿರಬಹುದು, ಎಮ್ಮೆ ಆಗಿರಬಹುದು, ಅದಕ್ಕೆ ಮೊದಲು ಏನೇನು ಆಹಾರ ಸಿಗುತ್ತೆ ಅದನ್ನು ತಿಂದ್ಬಿಡುತ್ತೆ, ಅದಾದ ಮೇಲೆ ಮತ್ತೆ ಮೆಲುಕು ಹಾಕುತ್ತೆ. ಸೊ ಆಕ್ಸಿಡೆಂಟಲ್ ಇಂಜೆಕ್ಷನ್ ಆಫ್ ದಿ ಫಾರಿನ್ ಬಾಡಿ ಥ್ರೂ ಫೀಡ್ ಆರ್ ವೈಲ್ ಗ್ರೇಸಿಂಗ್ ಇನ್ ದಿ ಪ್ಯಾಶ್ಚರ್. Here foreign body may be any metallic objects like a nail, needle or a wire. So reason is that a lack of oral discrimination in animals. So animals lack the oral discrimination, and so whatever I said here, the cattle swallow the food whatever they have eat first, then they regurgitate for the food they have eaten. So the incomplete mastication, so first there will be incomplete mastification before swallowing, okay, and then again they will regurgitate the whatever the food they have eaten. And one more reason is the greedy feeding of the cattle. So what is the pathogenesis, means what causes for this TRP? So the cattle swallow the metallic objects which directly falls into the it may be fall into the rumen, or it may directly fall into the reticulum. So there may be a chance. And now the elevated reticulomucosal orifice tend to retain heavy objects in the reticulum, and the honeycomb-like reticular mucosa trap the sharp objects. In the before slides, we had studied what is a reticulo-omasal orifice. So that is a vent or a hole that separates the reticulum and the omasum. So that hole or a vent will be elevated and will be closed. So therefore whatever the food eaten by the cattle will tend to be in the reticulum itself and will be restricted from the flow of food from the reticulum to the omasum. And one more thing you can see here, this is a structure of reticulum which is a honeycomb like structure. So whatever the heavy objects which are swallowed by the cattle with the feed will be trapped in this mucosal reticular mucosa, which is a honeycomb like structure. And further contraction of this reticulum will promote the penetration of the wall by the foreign objects, so which results in the formation of holes in the reticulum ಅಂತಂದ್ರೆ ನಾವು ನೋಡಿದೀವಿ ಮೊದಲು ರೆಟಿಕ್ಯುಲೋ ಒಮೇಸಲ್ ಓರಿಫೈಸ್ ಅಂತಂದ್ರೆ ಅದೊಂದು ರಂಧ್ರ, ಅದು ರೆಟಿಕ್ಯುಲಮ್ ಮತ್ತೆ ಒಮೇಸಮ್ ಅನ್ನ ಸಪರೇಟ್ ಮಾಡುತ್ತೆ. ಈ ಜಾನುವಾರುಗಳು ಏನೇನು ಆಹಾರವನ್ನ ತಿನ್ನತ್ತೆ ಆ ಆಹಾರ ರೆಟಿಕ್ಯುಲಮ್ಮಿಗೆ ಬಂದದ್ದು ಈ ರೆಟಿಕ್ಯುಲೋ ಒಮೇಸಲ್ ಒರಿಫೈಸ್ ಕ್ಲೋಸ್ ಆದಾಗ ಆ ಆಹಾರ ರೆಟಿಕ್ಯುಲಮ್ ಅಲ್ಲೇ ಉಳಿದುಕೊಳ್ಳುತ್ತೆ, ಒಮೇಸಮಿಗೆ ಹೋಗೋದಿಲ್ಲ. ಅದೇ ರೀತಿ ಈ ಸ್ಟ್ರಕ್ಚರ್ ಅನ್ನ ನೋಡಬಹುದು ನಾವು ಈ ಫೋಟೋ ಅಲ್ಲಿ. ಇದು ರೆಟಿಕ್ಯುಲಮ್ಮಿನ ಸ್ಟ್ರಕ್ಚರ್, ಇದು ಹನಿಕೋಮ್ ಲೈಕ್ ಸ್ಟ್ರಕ್ಚರ್ ಆಗಿ ಇದೆ, ಹನಿಕೋಮ್ ತರ ಇದೆ. ಸೊ ಇದು ಇದರಲ್ಲಿ ಹೆವಿ ಆಬ್ಜೆಕ್ಟ್ಸ್ ಟ್ರ್ಯಾಪ್ ಆಗ್ಬಿಡುತ್ತೆ, ಇದರಲ್ಲಿ ಉಳಿದುಕೊಳ್ಳುತ್ತೆ. ಮುಂದೆ ಈ ರೆಟಿಕ್ಯುಲಮ್ಮಿನ ಕಾಂಟ್ರಾಕ್ಷನ್ ಇಂದಾಗಿ ಈ ಹೆವಿ ಆಬ್ಜೆಕ್ಟ್ಸ್ ವಿಲ್ ಏನ್ ಮಾಡುತ್ತೆ, ರೆಟಿಕ್ಯುಲಮ್ ಅನ್ನ ವಾಲ್ ಅನ್ನ ಪೆನೆಟ್ರೇಟ್ ಮಾಡುತ್ತೆ, ಅದರಲ್ಲಿ ಪೆನೆಟ್ರೇಟ್ ಮಾಡಿ ಅದರಲ್ಲಿ ಹೋಲ್ಸ್ ಮಾಡುತ್ತೆ. ನೆಕ್ಸ್ಟ್, and now the perforation of the wall of the reticulum allows the leakage of the ingesta and the bacteria which contaminates the peritoneal cavity. Initially the peritonitis is generally localized and it may spread further. How? See, this is a heart. So heart is surrounded by a sac like tissue which is called as the pericardium. So in the before slides we had seen that the location of the heart and the reticulum, so we know that they are in close vicinity. If this is a heart, so reticulum is present near to the heart, which is separated by this pericardium. So this tissue, sac like tissue which is called as pericardium, contains the two layers, outer and the inner. Outer is a parietal pericardium and the inner visceral pericardium. So when the objects which are trapped in the reticulum, due to contraction of this reticulum, will penetrate the wall of the reticulum and they may come out, and they may cause the swelling and irritation in this pericardium. So this is the pericardium. So we can see here. So if this is a pericardium, so these nail metallic objects which may be a nail or any objects, so that may come and touch to this pericardium, leading to the swelling and irritation which results to the pericarditis. Also sometimes followed by myocarditis, means so it may get penetrated into the heart and inflammation of the heart muscles. So it may cause the inflammation to the heart muscles. This inflammation will reduce the heart's ability to pump the blood. Okay, so further, not only to the heart, it can also penetrate to the diaphragm and enter to the thoracic cavity, which is very very important. So not only, as I said, the peritonitis is not only it is initially localized, but later it will spread. So it may enter into the thoracic cavity, leading to or causing to the pleuritis. What is pleuritis? It is the inflammation of the tissue lining the lungs and the chest cavity. And sometimes the pulmonary abscission, means which leads or which causes the necrosis of the lung tissue and form the cavities or which may be filled with the fluid of microbial infection. So here we can see in this diagram or in the photograph, so this is nothing but the abducted elbow, which is an important sign shown by the uh, cattle which is suffering from the TRP. Clinical findings for this TRP. What are the clinical findings? Sharp fall in the milk production. So automatically milk production will be declined, and the mild increase in the body temperature of the cattle. So heart rate will be normal or slightly increased. Respiration usually shallow and rapid. So you can see here in this diagram or the photograph. So the cattle or the cow is unable to, or it is suffering to respirate, and it is respiring through the mouth. So it is taking a shallow breath. So it cannot or it is not able to respire through the nose, and it is respiring through the mouth. So that is a very important symptoms in the cattles which are suffering from the TRP. And also one more is this, we know that this region is called as brisket and peritonitis, or the fluid will be the contaminated fluid of which contains the microbes and microbial fluid that will be accumulated in the brisket, causing the brisket edema, and also distended jugular vein. So the jugular vein will be also distended. So these are also findings of the TRP. And arched backed anxious expressions, reluctance to move, and an uneasy and careful jet means. So the cow or the cattle affected by the TRP is unable to move, and it is having an anxious expression, so it is not able to move. Okay, and it will be raise its tail, and it will be standing in uh, arched back symptoms. So this is an arched back symptom. So arched back, and the grunt produced by applying pressure to the xiphoid or by firmly pinching the withers. So this region is called as wither. When you apply the pressure to these wither region, so you can see here this is a wither region. So when you apply the pressure to this wither region, so the normal cow or the normal cattle will move downward, or it will bend downward. But the TRP affected cow, when you apply the pressure on the wither of the TRP affected cow, it is not able to move down because of the pain. So it shows it starts kicking, or it shows some symptoms which is uncomfortable symptoms. Okay, so that is also clinical finding of this TRP. So that is normal cow will bend downwards, but the TRP affected cow is not able to move downward, and it starts kicking, or it starts moving that side, this side. So it shows some uncomfortable symptoms, and the arched back, anxious expression, and it is uneasy, and it is very slow in its movement. Okay, further we can find by placing the stethoscope over the trachea. And also both feed intake and the fecal output are reduced, and also milk production is declined to a great extent. Okay, next. So diagnosis. One can come to know of this TRP by the history and the clinical finding, and the laboratory test, that is neutrophilia with the left shift and the increase in the plasma fibrinogen, and the peritoneal fluid which is due to peritonitis. The peritoneal cavity will be affected, or fluid will be affected by the ingest and the microbial fluid. So analysis of that fluid will help for the TRP and diagnosis. So here this is a rubber hammer. So this is veterinarian in the photograph is using a rubber hammer to elicit a pain response by means of a percussion in the region of the reticulum in the cow suspected of having TRP. So when he beats with this rubber hammer to a region, it may be a reticular region or some other region, it may be up to brisket edema or anything, so that will show some symptoms, so which will be helpful in the diagnosis of TRP. Next, magnetic compass. So when you keep this magnetic compass near the reticular region, so it shows some sound. So through which we can get to know that the cow or the cattle has swallowed the metallic objects. And also the ultrasonography using a 3 megahertz uh, transducer. And next we can also detect it by electronic metal detector, which shows some deflection in the this machine. Next, treatment. There are two types of treatment. One is a surgical treatment and one more is a medical treatment. So medical treatment, we can use antimicrobials to control the peritonitis and magnet to prevent recurrence. Because of the mixed bacteria flora in the lesions, broad spectrum antimicrobial agents such as oxytetracycline can also be used, and penicillin will be effective for this to a limited spectrum. And surgical methods means the cutting of these skin of the cattle and removing. So you can see they have cut the skin of the cattle, and so this is a metallic object which they removed, and again they wash with the saline and they get stitched back. Okay, this is a surgical method. So last, prevention. We know that great proverb, that is prevention is better than cure. So how we can prevent the causing of the TRP? Avoiding the use of baling wire, passing feed over magnets. So we can pass the feeds over magnets so that whatever the metallic objects are there in the feed that get attracted to the magnets, and the uh, metallic objects free feed can be fed to the cattle. Keeping cattle away from the sites of new construction. So we know that in the area or in the sites of new constructions, there will be a large amount of metallic objects, so that keeping these cattle away from these sites will be helpful. And again, we can use the magnets, or we can place the magnets in the reticulum, so therefore which will hold all these metallic objects. And also to minimize the incidence of TRP, so they are giving the magnets to the all herds placed herd placement heifers and bulls at the 1 years of age are recommended. Okay, this is the end of this lecture. By this, I feel you are familiarized with what is a TRP, and how to diagnose it, and what are the clinical findings and treatment and the prevention. So let me briefly explain or briefly put it out of TRP. What is TRP in brief? So whenever the cattle's ingest these metallic objects through the feed, uh, it will be moved to the reticulum. So the reticulo-omasal orifice, which is a vent or a hole which separates the reticulum and the omasum, will be elevated and will be closed. So therefore, what the food which is swallowed by the cattle will be stayed in the reticulum itself. And one more thing, the structure of the reticulum is like a honeycomb like structure. So whatever the heavy objects which are present, there may be a metallic objects which are present in the feed, will be trapped by that mucosa or reticular mucosa. And further contraction of this reticulum will promote the penetration of the reticulum by the foreign objects, or that is metallic objects. So initially this peritonitis is localized, and later it may be spread. So we know that heart is very in very close or near vicinity, or they are in close vicinity. So which is just separated by the pericardium. So whichever the metallic objects which are penetrated the reticulum and came out, so that may inflammate the sac like tissue, that is the pericardium surrounding the heart, leading to the pericarditis. And later it may also move to the, or it may penetrate the diaphragm and cause the pleuritis. So also we saw the clinical findings that may be a increased heart rate, and shallow and rapid breath, respiration which is unable to respire, and arched back, anxious expression, and tailed up, and so uneasy to move, and whenever you apply the pressure in the wither region, so it shows some uncomfortable symptoms. So all are the clinical findings, and also diagnosis that may be by placing the stethoscope, using magnetic compass, or by fluid analysis. So many methods. And also there are some treatment methods we saw. They are surgical and the medical treatments. And last, we also seen by knowing the great proverb, that is prevention is better than cure. So we can prevent the TRP by following many ways, so which are enlisted. So by this we conclude this lecture. Thank you one and all for hearing this lecture. If you feel the lecture good, please like, share and support, and also please share it to the others, that they also will be familiarized by this disease, and they will be aware of this disease. So please like, share and comment. Thank you.